This is a big deal. This is a big procedure, especially with hunting dogs. It's not your backyard dog that's going to get the knee surgery. They're going to do fine. They're going to have just a pretty average life. If you have a dog that do what you and I do that has this happened, it's a huge bummer because I've had shoulder surgery and it's still never 100%. Same thing with these. You're going to be significantly better and you're going to do whatever you need to do and everything's going to be good. But every once in a while, you're going to still see your dog limp and still see some things. But for the most part, that's just arthritis and part of the process. I think it's important that you find an orthopedic surgeon and a vet that literally explain and hold your hand during this whole process. And I think that's why Cliff kind of wrote what he did. And I'm glad he did because I'm going to share that with people because we as vets sometimes forget, what are you going through at home? Because this is routine for us. From 7 o'clock to 5 o'clock, I go home and then you're sitting there, the dog's whining, he's not sure what to do, you have medication questions, and we have, a text helpline, and we check in the next day after that, the 10 day, you need that so that you have a successful outcome.
All right, everybody, the GDIY vet's back in the office. Jay Brekke, how we doing today?
I'm good. How are you, Nick?
Living the dream. I appreciate you kind of giving the turkeys a break out in the woods to join us here today. How's the season been going for you?
So far, so good. Just went up to Kansas last week for a quick little hunt, and first morning just put the sneak on and got set up just right, and they read the playbook and had one down by 6:50 and I was done.
Oh, wow. Played ball for you.
Yep. Head to Northern Michigan on Monday. So
nice.
That's the plan there.
You're linking up with Connor Goff, I'm assuming?
Yep.
Yeah.
Connor, and then we're going to do some fishing with a buddy of his there on Saginaw Bay. So a little walleye fishing, turkey hunt combo.
Nice. Well, you'll have to tell Connor I said, hey, did you appreciate the episode I did with him a few weeks back?
Yeah, no, that was good. So I know he really appreciated it. And hopefully like I said, my goal too is to try to dial in some rough grouse spots.
Yeah. You'll have to let me know, man. It sounds like I'm heading back to the UP area this fall as well. So keep me plugged in. Any pins, man. That's it's always appreciated, right?
Yep, that's the plan. So, yep.
All right. Well, we don't have to beat around the bush too much on this one. Let's just jump on in. If people listening to this one haven't tuned into the previous episode before this, I had Cliff Hawkins on, and he had written a really thorough article through the lens and perspective of a dog owner on what it was like dealing with a CCL injury, or at least how it relates to us, the ACL injury. To me, it was really informative. It was very thorough. It gave a very honest and kind of no bullshit perspective on what it was like going through the entire process, from injury to confinement to getting the all good clear to run your dogs again. And obviously, in the space that you and I really appreciate and love, in the gun dog space, these dogs, they run a risk of getting injured. There's really no way around it. We're going to get into kind of different risk factors or lifestyle factors that can kind of either mitigate it or make it even worse or exasperate it. But to me, it was really eye-opening and something to where he answered a lot of questions that somebody else facing down these type of decisions and journey would typically have. And so I thought it would be neat to get his perspective as the owner and recap his story, but then also go a little bit deeper into the actual scientific considerations or technical considerations from the vet's perspective, because unfortunately, kind of tell me what your thoughts are on this. Anecdotally, like when I'm talking to people, it seems like this is becoming more prevalent in the gun dog space, whether that's from a breeding standpoint, over exercise, nutrition. Like there's a bunch of different ways we can go through this. But I guess let's just start there. Are you guys truly seeing more cases of these type of injuries than in generations previously?
Yeah, no, so I would say that for us, I don't think we're seeing more cases. It's very consistent, even with our clinics growing and seeing more more animals. But I think now we're better at pinpointing it. Dogs are living longer. We're more in tune to their lameness and limping and wanting to do something. I'll have to find it. That way you can add it to your cliff note or to the bottom of the after the podcast there. I believe there's a couple universities doing some studies on the genetics of these injuries. I think one of them, I think might be University of Minnesota. But basically, yeah, we're starting to find that it's kind of a genetic thing. Definitely a confirmation. It's how the knee is sloped, and how these dogs maybe have been bred this way, or certain breeds are more predisposed. You know, we see it a lot in the bulldogs, and we see it a lot in the labs, the Great Danes, American like the pit bulls. So there's certain breeds that we definitely see it in. I just find that they have a little bit more of that kind of structure or conformation, which is if you're looking at a knee X-ray on the side, that there's just a decent slope on top of the tibia or the shin bone, and that is just going to put so much more stress on the CCL, or we'll just call it ACL in this episode, just to help with
Right.
people understanding. But definitely that ligament just doesn't seem to hold up, and I think big concept that a lot of vets like to point out that a lot of dog owners don't understand, or until they kind of hear it, and it takes a while to kind of believe it too, is that if you and I hurt our ACL, it's usually something traumatic: skiing, football, slipping and hiking. I mean, it's usually a injury. In dogs, it's just that's a small piece of the puzzle. We truly think that it is a degenerative kind of long-term chronic thing that's going to happen eventually, just by the shape of the knee. Because if you look at next time you look at your dog, look at their knee, how it's kind of always at a 45, 55 degree angle a little bit. And when us, we're either sitting down or we're standing straight up, there's not so much pull on it. And so if you think of the ACL as kind of a braided rope, you'll get little pieces that'll snap over the years that then equal a partial tear that then turns into a full tear. That's the degenerative process that we think that we're seeing. So I think that's a big difference.
Just over time through the strain, if they have kind of the undesirable slope in the knee, just over time it's going to fray, and just every time you lose that strand, that just puts more pressure on the rest of the strands, and then eventually it just snaps.
Yep.
It begs the question then, if we can notice it, or at least kind of see the trend in regards to the slope. We hear all the time about hip certifications. Why can't we do that with knee certifications? Is that something that some people are trying to do? Is it becoming more clear for breeders to start requiring different certifications for knees, just like we do in hips?
I think so. And I think that's what some of these universities, like I said, I think it's Minnesota. I got to find that for sure. But I think, that's what they're looking at, because there's a couple different websites out there. Like the one that I gave you, TPLOinfo.com. They have, in one of their videos, they show two knees that have way different conformation. One that is a good flat slope of the shin bone, and the other one, genetically, this dog was just born with a very sharp slope. That one is very prone to getting this. And so I believe, fast forward 5-10 years, that when you go to buy a puppy, you're going to see eyes, hips, elbows, knees, thyroid. I think those are going to be some of the big ones that are going to be on there, because a lot of times by the time that this happens, I mean, it can happen at any age, but usually it's 5 to 8 years old, and those dogs have already been breeding since they were 2, 3. So then it's already too late. So yeah, I do hope so. We'll see what's going to come down the pipeline, but I do think that we're going to be able to pinpoint that. And even genetically, there might even be some different blood tests or genes that they can kind of pinpoint. So then we know not to keep breeding those dogs. So,
well, I mean, even just without the certifications, until we kind of get to that point to where it becomes viable or readily accessible for breeders as options, I wish the community could kind of come together and figure out a way to where very often you start hearing about certain lines or certain dogs that throw their puppies that are more prone to this type of injury. And yet they are aware of it, but then you notice the next year they're doing another litter with the same dog, right?
Yeah.
And
Yeah.
so like it's hard not to tell somebody, especially here in the US, like, hey, it's your dog, you're free to do with what you want with your dog. But like if we know that there's an issue there, stop breeding that dog.
Yeah.
You know,
Yeah. No, I think about that all the time, and I see it. I mean, especially in like the bulldog world. Holy cow. Um, you know, getting a bulldog is like getting a used vehicle. Like it's crazy. So yeah, I think, I think about this all the time, and I think that eventually I think that there's going to be, a group of veterinarians that come together that's probably going to be associated with AKC or the OFA, where we're going to have kind of like they do in horses, some of these breeding soundness exams, where we are going to have a stamp of certification for a male or female that we say, yes, everything checks off. So is it still going to happen that the dogs that shouldn't be bred are being bred? Yes, but as an owner, well, if you're a new puppy buyer and you see that this female and this male that are being bred both have the stamp of approval that some of the group of veterinarians can make that says all checked normal, then that's the puppy I want. And so the people that aren't doing that, hopefully they won't be selling the puppies, or they'll see that, well, if I don't get this sire approved, in whatever we might create, people aren't going to want the puppies because that's so common. And so, I'm not going to do that.
mm-hmm.
So we'll see, because otherwise it's just, yeah. But the problem is then we'll be probably breeding for all those good things, and we'll unintentionally forget about something else and have some other issue.
Oh yeah,
So,
no, I mean it's an ever, no matter what you squeeze on the balloon over here, the other side's going to blow up. It's a
yep.
constant balancing act, and we're constantly reacting to something, but unintended consequences, right? I mean, it's the nature of the beast. They can be well intentioned, but you never know what you're causing on the back end of that.
Yep.
In terms of paying attention, prevention, not even prevention, but just being aware of the potential issue with a certain dog. Genetics aside, they are kind of what they are. Let's say you have the puppy now, like it's just the genetic makeup is not changing in that puppy. What other factors as the dog's coming up? Is this something that you can start noticing in young puppies? Because I know their joints and ligaments aren't completely mature. They're constantly forming throughout essentially the first year and a half of their lifespan. Is this something with the slope of the knee that we can kind of pick up on early, or is that just too early to really pick up on it? Because I've heard dogs like as young as like 6-7 months getting this type of injury. So let's just kind of talk about the puppy formation of the joints and ligaments and how that plays a part in this.
Yeah. So a lot of it is, I think, obesity, one of them. And I think, a lot of the different dog foods that are too high in fat or protein. So these dogs, some of these puppy foods are just kind of, they're hot rations. It used to be that, and this was kind of in the 90s, early 2000s, where veterinarians would encourage dog owners to switch from a puppy food to an adult food at a very young age, because we found and knew that puppy food was just too rich and dogs are getting fat, and then they're having elbow issues and hip, knee, you name it. And so the dog food companies came out and said, oh, this is not good. We're not selling our puppy foods. We need to reformulate this. And they did it correctly. So technically nowadays that shouldn't be an issue. However, it's still very easy to allow some of these dogs to get overweight. And so from 8 weeks old until, they're well over a year, I think that really not only feeding the right food, but also paying attention to every day you look at them and you say, okay, because a lot of these like short hairs or a lot of these sporting breeds, I mean, it's not like a big Newfoundland where you can't really see their ribs, or like a big Doodle where they're just all hair. These breeds you can eyeball and kind of see, like, okay, you're looking a little bit heavier this week, and I was working, all the time, and we just didn't get out, and you're just in the backyard and you weren't doing anything. So I know you weren't getting the exercise. You're looking a little heavy, and you start to same food, but you just start to cut back and you just play around with that every week. That's what I do. And I think that's key, because if you just feed the same amount every single day, but you don't pay attention to what the dog's doing, that's different. Um, and then as far as the different foods, I mean, that just opens up a whole nother can of worms. But a lot of the different Purinas and Hills and Science Diet, Royal Canin, and a lot of those big brands like that, they do have good foods, good formulas, especially for sporting dogs that keep them lean. They have, you can really kind of get into the weeds on all that, but I really feel that the amount sometimes is more important than the food.
Yeah.
Um, but the obesity thing is number one that you have to watch when they're that young. It used to be, a lot of different joint supplements. You have all your different omegas, fish oils. A lot of good ones now are actually coming from like sardine, anchovy, dog fish oils that they're recommending, kind of getting away from the salmon, some of the bait fish. Those are always good to add in conjunction with a glucosamine chondroitin. The most popular one out there, people always talk about Cosequin, Dasequin, all the quins basically. I will say that the top of the line Cadillac one, in my opinion, that also is correlated with some of the new human glucosamines, is Dasequin Advanced with eggshell membrane. So this new eggshell membrane concept is the new thing that is good. So think about if you're cracking open an egg and you see that little membrane, they figured out how to put that into this supplement. So when you hear Dasequin, there's actually three generations of that. There's Dasequin, Dasequin Advanced, and then Dasequin Advanced eggshell membrane. You want the one with eggshell membrane. And that one, in my opinion, is the best because it has some natural anti-inflammatories in it. You got your glucosamine, your MSM, you got the eggshell. I mean, it literally is the top of the line, in my opinion.
Well,
Um,
that's good to hear because I've actually been supplementing my dog's food with eggs. I got chickens out here.
yep,
It's that time of year. I got an endless supply of eggs, and they
yep.
like it. And I just crack just slightly crack it, throw it on top of their food, and I think they just enjoy the crunch. And what I've found interesting is they almost self-regulate their bodies. It's like their body knows exactly what they need. If they've gotten too much calcium or whatever it is from the eggshell, they'll leave like half the eggshell. But then other days, especially on days that I've run them, I notice that they eat all of it. And then it's just like I don't have to worry about like them over consuming any of it. It's kind of like they just take care of it themselves. And I picked up on that from some buddies of mine that, they just kind of throw it in there. We talk about all of the health benefits from so many aspects of the egg. And then I was listening to a podcast episode on my buddy Grayson's podcast where had Emily Shirey on, and they were talking about raw food and everything. And she was talking about the importance of like the balance of bioavailability and all that stuff. And
Yep.
she's like, the egg is perfect. You don't have to worry about balancing it out with anything. You just throw the egg in there, nice raw egg, and it just takes care of it. And my dogs have really been enjoying that.
Yeah. Yeah. No, I mean, there's a thing out there called NPU, net protein utilization. And it's in dog and human field, basically how much of a certain protein is your body going to utilize. And egg is 88% net NPU. So that's a pretty good percentage. And like beef is like 63%. So that's kind of a good comparison of what you're actually going to utilize. So yeah. And the key with a lot of these glucosamine supplements now is that we made the mistake as veterinarians to really only start it, recommend it, do it when these animals were showing signs and coming to the vet, and owners are then saying, "Oh, they're slowing down. They lay down and they groin. They're slow to get up." And the new thing now, and a lot of orthopedic surgeons are recommending that we start this at 1, 2 years of age. Some people say even puppies. I kind of go by 2 years of age, where you throw it in their food every day, because that is going to basically help preserve a lot of the healthy joints and cartilage, and prevent kind of a catabolic change that's going to happen naturally.
Yeah.
So that's definitely a supplement part. And then proper exercise. I mean, warming up your dogs, make sure that you're consistent with certain exercise, make sure that they're not jumping out of the back of your truck, that you're helping them out and kind of eliminating a lot of the big injuries that can happen
Yeah.
around the house or the truck. And they're going to do what they're going to do in the field, but at least you can minimize that and then
Yeah.
just really kind of warm them up and do proper exercise to where those joints and ligaments and everything are all active and kind of ready to go. So
Yeah, absolutely. Let's jump into, all right, prevention aside, genetics aside, all those considerations aside, it is what it is. Let's just say we're in the woods, dog has a freak accident, comes up lame, comes up limping. Kind of walk me through from in the field till we notice the limp, getting all the way to your office.
yep. Yeah. So what owners will see, sometimes there's a yelp with it, sometimes there's not. If it kind of goes from a partial or no tear to a full tear. So it's not always associated with a yelp or what we would say is a sign of pain. But what you'll notice is definitely a back leg limp where they do what we call toe touching, where they're just kind of tapping their toes. They don't want to put full pressure down. And at this time, the dog's not going to really know what's going on. They're going to get around with three legs and they're just going to be toe touching. You're not going to see any muscle atrophy. You're not going to see any swelling. You're just going to see that toe touching. Usually, what people do is that, especially sportsmen, is that we usually have some type of anti-inflammatory, Rimadyl, Duramax, Previcox, Medicam, different anti-inflammatories that we're going to give, knowing that they're sore and we have it in our first aid kit. You might see some improvement, a little bit of help. Next day, dog's going to be pretty lame, not wanting to use it, toe touching. When they sit down, they kind of kick that leg out to the side. If you do see that, it doesn't automatically say this is a torn knee. That's why a lot of, obviously you want to get to well, by the time you call the vet, it's probably going to be a week or two till you get in, which is kind of good timing just to see how they do with just some time off and to see if it was just a soft tissue injury. But if you notice after, a week or two that it's just not back to normal or it's not getting any better, then yeah, it's best to get into the vet so that they can examine the knee with the physical exam to check to see, just like if you and I tore our knee, we do what's called the drawer test, which is where you grab the top of the leg and the lower and you just kind of see if there's movement within that knee. And then usually we try to get a couple x-rays, and we always get one of each knee, including even the good one, just because you want to get good side-by-side comparison. And sometimes you'll see early changes in that one as well. So you and I will go get an MRI. Dogs, we all do x-rays. With x-rays, we can see arthritis, we can see joint effusion or swelling. We can sometimes see how the leg has shifted a little bit, showing that the ACL is not intact. But more importantly, we look for the toe touching, muscle atrophy, swelling, some pain, and then those x-rays are very diagnostic. So MRI, we've been doing these surgeries for 9 years. We have a outstanding orthopedic surgeon that comes in that's been doing it for 30 years. He's done 9,000 of these, and never have we done an MRI then surgery. There are some places now that might do a CT, they might scope then do it. I mean, that's some of the new things that are coming about, but I think it's important when you go in and your vet wants to do or recommends or kind of prepares you that there's a big surgery might be needed. The first thing that owners think about is, well, no, he's wrong. Why are we not doing MRI? Like, we do an MRI all the time for this kind of stuff. X-rays for bone. Like, why are we doing this? But trust us, this is diagnosed with an X-ray and physical exam.
You kind of went down the path, like, just out of curiosity. I don't think we need to hang up on this too long, but I'm curious why ourselves we would require or look for an MRI, where in dogs that's not necessary. Is it just a cost prohibitive thing? Maybe it's not necessary, to where in humans we're just like, we'll incur the cost. Like, I'm just kind of curious why it works better in our favor as opposed to the dogs.
Yeah, so cost is one thing, and then anesthesia. You and I can get an MRI and we can be awake and just sitting there. Dogs have to be under anesthesia. So MRIs are almost as much or more than the surgery itself. And I think in people too, that there's usually a lot of other, ligamental issues and meniscal issues and other things that they're really trying to look at, where with dogs, we know if we see the telltale signs that we need to go in, that while we're in, then we visually see and change and fix what we're, what we can. And so, yeah, there's some of that I don't know 100% why we don't, but I bet I think the biggest thing is we're very confident, feel very good that X-ray can do it, and no anesthesia is needed, and it's very cost effective to do it that way.
Roger that. Let's move into the different surgical options in this regard, because I'm vaguely familiar, high level of a couple different options here from my understanding, and I'll let you kind of take it from here. Is one is really more beneficial to us, especially as gun dog owners, and getting our dogs back up to a performance level, as well as the failure ratio, how likely it is to fail. But from my understanding is you kind of have two primary options here in the TPLO as well as the ECLS options. Kind of just, if there's others, if one is not really worth even recommending or consideration, I'll just kind of let you take it from here and give us your honest thoughts and feedback on these two approaches.
Yeah, so the two approaches basically is what we call extracapsular, which is basically you're outside of the capsule, outside of the knee joint itself. Basically, the idea there is we do what's either called a lateral suture or tightrope. There's another one too, but these are the two common, where you're not going into the joint, but on the outside of the knee, you're basically putting in heavy surgical suture, which is almost like heavy fishing line that acts as just this knee brace that's under the skin that is on each side of the knee. That one's very debatable these days, because dogs under 30 pounds, which is a lot of not our sporting dogs, maybe some, that's a good option. They do really well with that. It's a lot cheaper. And so the extracapsular for dogs under 30 pounds is what we do, and it's our cutoff. I do know some vets that still don't believe in it, and no matter what, they still do this TPLO. But just to kind of let people know that most of our hunting dogs are over 30 pounds, I would veer hard right for this extra. You do not want to do this for these. And I've seen people try it. It's also a procedure done by non-boarded surgical, veterinarians, that just because it's much more simpler and cheaper to do. But they either break, they get what's called quadriceps contractor, which is where the leg kind of stiffens up because they don't use it or it's not done right. And so extracapsular, if you go to it, if a vet says, oh, it's half the price and we can do it tomorrow, all that kind of stuff, but your dog is over 30 pounds, your failure rate is going to be, I mean, at that point, not really a percentage, it's just a yes.
And if you do go that route, if you do decide, let's say you have a 25-pound, French Brittany or something. I think that's the smallest pointing breed. Yeah. Let's say you have that, you do go with that. It does have a higher failure rate. If it does fail, are you out the option later to try the TPLO? Like, does that limit you?
Good question. We've had quite a few of these, just basically what we would call revisions, or and no, you're not out, but the arthritis that has developed, the scar tissue that has developed, the bone is weakened. We had a dog one time where it was a big dog that had it and it failed, and we went in and we had to remove all this old suture, scar tissue. We were not able to put a TPLO in or a plate in at that time and do the correct procedure, just because the bone was it was just like 3-day-old oatmeal, is a good way to the surgeon described it. And so we had to basically get all that crap out, heal it up with antibiotics, and just kind of wait and then go back in and do that. Now, again, a little risky at that point, because is the bone sturdy enough? And so that case maybe was most severe, but a lot of times, no, you can go in, remove the extracapsular procedure and do the correct one. But a lot of scar tissue is formed, and it's is it functional? Yes. Is the dog going to have, maybe more pain or arthritis when they get older and maybe slow down 6 months to a year sooner than another dog? Absolutely. But it's kind of like dogs that never have the surgery.
Yeah.
their x-rays look very similar to the dogs that have had a failed extra cap, where there's just arthritis and scar tissue and just looks like a mess.
Yeah. Well, and again, it's like you said, anybody in this space, anybody listening to this, 99.9% of the people, like, just go with the TPLO. But I wanted to ask that question just in case your dog's small enough, and let's say you can't afford to go with the TPLO, and you want to roll the dice with it. There is an option in that regard. So let's jump into the TPLO. Let's go into that whole procedure and why you recommend that as really the only viable option surgically.
Yeah. So basically, what we found, so in people, obviously we get our actual ACLs replaced and the knee kind of cleaned up, and we get cadaver ligaments or whatever they do. I'm not a human doctor, but they basically will go in to replace the ACL. What we found in dogs is that we try to clean up the ACL and the meniscus as best we can when we go on the approach, or the side, is the inside leg, the inside of the leg, not the outside, where we will then go into the joint capsule and, like I said, kind of clean up what's torn and what's inflamed. And then all the procedures that are associated with animals and fixing this require an osteotomy, which is cutting through healthy, good bone and shifting that bone to creating more of a level plateau or top of the shin bone. So we talked about the conformation. The top of the shin bone we want to be level, not sloped. And so the TPLO stands for tibial plateau leveling osteotomy, which is a very specific circular kind of half moon cut at the top of the knee where we rotate the bone, and then we put a plate in to keep that angle, because bone heals so much better and quicker than soft tissue, ligaments, tendons. So that's why we like that in dogs, because they don't know how to rest and take their meds and do physical therapy like we do. And so that's one of the biggest reasons. And then the other one is called TTA, which stands for tibial tuberosity advancement, which is more of a cut in front of the shin bone. That one, there's nothing wrong with that one. It's just not as common. TPLO is a lot more. It's been more successful. More people know how to do it, and it's a little bit more user friendly, I would say. And so, yeah, there's another one that, I forgot the name of it, but those two are the biggest ones. So basically, that's what's another weird thing too, is that you need to understand if we're going to be going down the route of these procedures, and usually it's going to be the TPLO just because it's been the most successful. And like I said, the surgeons, that's what they're trained for. They've done thousands. You want to keep it the same. Don't try to change any of the, don't request it if you read certain things, all that. But the TPLO basically is the way to go to change that plateau angle, which then leads to a lot of the stability of the knee changing just because of that angle. So a lot of the pressure, the weight, or the support of that knee now is on the patellar tendon, the muscles, the lateral collateral ligaments, and it's kind of sparing the ACL that's not really intact. And so it's kind of a hard concept to grasp, but basically the biggest thing to know is that by doing that procedure, you're making the knee stable again.
Makes sense. So let's just assume you go in, you fix it. There's no complications in surgery. It's your basic average surgery as you had hoped. Where are we going at now? I mean, now we're in kind of the healing process. What are you recommending? What's your typical advisement for your clients?
Yeah, so a couple things that if anybody out there listening has this right now or is going to go through it, all the surgeries aren't created equal. So one thing that TPLO had an issue with years ago was that we didn't use locking screws, and so there was some movement or shifting in the plate. Nowadays, they're mostly locking screws, and so I'm asked to make sure that the surgeon uses locking screws. And then the other thing too nowadays, a lot of these plates that they're using are actually infused or coated with an antimicrobial, so the chance of infection's less. And then one thing that we started doing too is we use a local nerve block. We numb the knee with a product called Nocita, which is an injection of all the nerves around the knee to numb the knee pretty much for the next depending on the dog, 1 to 3 days. So then they wake up, they don't feel actual pain in the knee for the next 1 or 2 days. So they're less likely to bite or chew or lick or mess with the knee. So if you have the locking screws, the plate that has an antimicrobial in it, and your vet does the local block, you're going to be a lot more successful. So we do all three of those, and our infection rate is less than 1%. Some people report these infection rates are all the way up to like 10 to 15 at certain hospitals.
And so that's a good touching point to where when you are talking to your vet and considering your options here, is that important for me as an owner to clarify with my vet on the type of metal used, the type of hardware? Because correct me if I'm wrong, a lot of you guys are using titanium screws and plates now because it's less porous than like stainless steel. Is that relevant, or should I, as the owner, be clarifying that with my vet, or is that just kind of like each vet has their process? Like, is this a consideration for me to actually dive into the weeds that deep?
Yes, I think it's what you're going to get what you pay for. And so if you ask, what usually happens is places that are going to be probably $500 to $700 cheaper, or even more, are using. Well, most everyone uses the locking screws now, but the special plates or the local nerve block, that's not in all of them. And so, but if you ask the vet and be like, hey, I listen to this podcast, I want to make sure you use, good locking screws, the local nerve block, and the plate that has an antimicrobial around, like all that. And they say, yeah, we're going to do that. You're going to decrease the chance of issues later on, which you don't want, especially in the hunting dogs, is because these dogs are athletes. And if that plate does get infected, usually what's going to happen is that it'll get swollen, it'll have pus coming out, and then anywhere from 2 months to a year later that you have to go back in and remove the plate, which is another procedure, another recovery, another cost, everything. And those are just complications that you unfortunately have to pay for as an owner, just because they are complications that are unforeseen. So but by doing kind of what I said, and picking a surgeon that has done plenty of these, that is board certified, you're going to decrease the chance of that significantly to where you can confidently feel better that you're not going to have issues. Because usually what happens is people go, I need to get it fixed in July so my dog's ready to go for September. And then if the plate gets infected or there's a lot of pain or recovery is horrible, you're going to miss that season.
Yeah, makes sense. Now you reference, you get what you pay for on this. I'm kind of an advocate. I'm not like everybody else. I don't want to spend more money than is necessary, but life lessons, it teaches you: buy once, cry once, do it right, get the right people. So generally speaking, obviously this is going to determine based on your doctor, maybe even your region. There's a lot of variables that go into this, but generally speaking, let's assume that there's no complications. It's just a straight and forward TPLO procedure. What dollar range should we expect as owners going into this, to where maybe we don't like jump out a window once they tell us, when they come into the office and advise us how much this is going to cost?
Yeah. So region's huge. I can give you some examples there, but in general, I find that if I was going to take averages, from East Coast to West Coast, that if you're between 4,500 and 6,000, that right there tells you that it's a board certified surgeon and they're using all the proper techniques and materials. Now, I'm here in the Denver area. Ours are anywhere between 52 and 54, and that's with the board certified surgeon and the whole kit and caboodle. I have some places in this area that are giant specialty places that are all the way up to 7,000 to 8,000. And then we have a guy in northern Denver that is not board certified, but he does lots of these, and he's right around 3,500. And my uncle that lives outside of Missoula, Montana, he's got big labs, and he just had to have it done last summer, I believe. And he paid 3,500 in outside of Missoula with a board certified surgeon and the proper stuff.
Nice.
So that right there is, you just pick that guy up and put him here in Denver, and it's going to be 5,200.
Yeah.
But vice versa. So that's the same thing, just that's the region difference. So, but in general, I think 45 to 55, 6 is going to be where you're going to target.
And honestly, that's a little bit more approachable than a lot of figures that I've kind of seen or heard throughout the years. So I'm curious, and this kind of goes back into the question I asked a minute ago, and then we went down a rabbit hole. The recovery. So is this an option to where, let's say you're in a place that charges $8,000 or $9,000 for this procedure, but you can just, a half a day's drive, get to somewhere that's, let's call it 4 or 5 thousand. You save that money. Obviously, you will come out ahead financially. Are the dogs able to travel in the car effectively to make that road trip home? So, like, let's say we have a 10 or 12 hour road trip. Is the cost savings worth the headache of trying to move the dog after the surgery? Does that make sense?
Yeah, I think so. I think I mean, if it's between, $500 and 1,000, I don't think it's worth it. Just go with your local person. But, there's, like I said, if we do one for 52 and I know someone, that does it close to 7, I think that it's definitely worth the drive because these are usually outpatient procedures. All of ours are outpatient. Drop off in the morning, we get it done. They go home later that day. There are some places that keep them overnight. I don't think that's necessary. A lot of dogs want to be home. Owners want them home, and you can take care of them fine. So if you say you are 10 or 12 hours away, you get it done. Probably have a hotel, or if you just want to do that's going to be a all night drive at that point. They're usually pretty sleepy and sedated, and they give you different medications. And if you have a big enough kennel, or if you have some type of way to have a lay your seats laid down or some way that they can they usually have we do bandage on ours, and then they have a cone, so they're not going to get to it while you're driving. So if you're
Right.
driving and you think though, are they looking at it in the kennel? If they have the bandage on and a cone, not I don't think so, but you do want to check that. But
Yeah.
no, I think it is worth the drive, and especially if you know that this person in this town, that their surgeon has been doing it for 20 plus years and has got 8,000 over his belt. Like that's you can't beat that option for that price, and it's definitely worth it.
For sure.
So not all surgeons are created the same. I mean, I just like the guy that we use, known him for 9 years. He's done these for that long. He's not only just has great outcomes, but when you watch him, uh, he's very gentle. Everything is the same. Everything is very clean. He has the same 2 assistants every single day. He has his routine. He has his system, his process, and we have our system, our process, and that is the way it needs to be done.
Yeah. He has it dialed in. Uh, Talking with Cliff on the previous episode, he brought up one of his tips that he advised people is when on the pickup time, when you go in, you grab your dog after the surgery. He advised having two people, one person driving and the other person kind of sitting and kind of supporting the dog in the back seat. And he raised up a good concern to where obviously if you got a dog with a bum wheel and you go put them in the kennel, which we talk about the importance of having these small confined den like crates, maybe it's not big enough for them to really lay down comfortably when you're talking. You don't want them moving and bending that knee very much. What's your typical best advisement for getting the dog home? Is it something that you can kind of trust, put the dog in the floorboard or lay the seat down flat and roll with it? Or are we kind of trying to like put the dog in backwards into the kennel or something like that?
Yeah, yeah, no, that's a good point. It's always very awkward. Yeah, most of the time it's always two people that show up anyway. But we tell people that, and then prior to the surgery, we either use a towel kind of around the belly to help support the back end, or you can go on Amazon
The
and order the
sling.
different sling or harnesses that are for the rear end, not the front, that have all the handles. And so, but I've seen some surgeons where they do not do a bandage. And so then basically the knee is kind of free to flop and move and twist and turn. When we do a big padded bandage, it's just this brick of a bandage that there's no moving. It's kind of just dragging this thing along. It's only for 24 hours, but we like it for that reason that if it bumps, swings, slides, hits the kennel door, all that, it's got, 2 inches, 3 inches of foam that it just doesn't hit, and it kind of acts as a compression bandage. It keeps them from looking at it. Again, it's just 24 hours, but the kennel situation is kind of goofy because you usually have to put them in backwards. But when I had a different uncle a couple years ago, he had a German wire hair pointer that had both knees had to be done. And so we did it, and I took care of the dog and brought it home and kind of went through what an owner would go through. And what I did was in my truck, quad cab, I just rolled up the back seats, folded them up, and then just put in a bunch of comforters. And, because you have the kind of little slope in there from the floorboard up to where, the storage is for your jack and all that.
Yep.
So I basically just made like a big
Pallet
bed in there, and she just laid right there with her big, basically, it worked great. So, but if you have a dog that's going to be getting up and moving around, you're driving, and you don't have anybody to help you, then you can be in trouble.
Yeah. Let's get home on this, because we talk about, and Cliff was talking about in his confinement, I think if the dimensions are correct, I think he said it was like a 4x8 confinement area that this dog was relegated to for essentially 8 weeks, and then like after that 4 weeks, they got a little bit more controlled freedom, if you will, and then another 4 weeks, essentially, like he was talking like a 4-month recovery process throughout his. So I don't really want to compare and contrast like what his journey to what you typically advise. I just kind of want to hear what your personal advisement and experience is. What are you telling people to expect? What do you tell people to get their just kind of chilling out zone, if you will, at the house? What does that look like?
Yeah, so the first 10 days I think is the most critical, because that's when surgery's done, and then sutures are going to be, or the stitches are going to be removed at 10 days, which are just a couple outside ones, not a big deal. But within those 10 days, what the owner is going to notice and what they're going to see, especially the first couple days, is that the dog's going to be pretty sleepy, kind of out of it, but getting around and kind of wanting to get back to the routine of checking the fence and the squirrels and when Amazon shows up and all that. And so the confinement thing is interesting, because you have to think of confinement. You also have to think of the sedatives and what medications are sent home. Most of these dogs the hunting dogs are usually very well trained. And so it's very easy to either have them on a longer leash that you have control of when you're watching TV or sitting in the house. But if you're going to leave or you're going to bed at night, then you need like a laundry room or a bathroom where they can just hang out in there with lots of padding and room to get up and get around, room to get water, room to get food, and then lay back down, but not too much. But most of the time, the hunting dogs are good about that. Now, the ones that are kind of wired or owners don't feel they have good control, I don't really think about confinement so much as the sedatives. I think that's so much easier, because if you think about how much dogs usually sleep all day anyway, or especially when they get older. So if we can give them different cocktails of different medications and there's a lot of new studies and different things out there for pain management and that are for this, that you can say, okay, listen, like, we're not going to dope up your dog for the next 30 days, but these first 10 days, like, they're going to be a bum, and they're going to sit around, and they're not going to care when UPS shows up, and they're not going to care when the garage door opens. That's so confinement also, but make sure you get the proper sedatives as far as, medically your dog can handle it too, as far as good heart, liver, that kind of thing. But the biggest thing that you see within the first 10 days, especially, is when dogs get in trouble, because they're kind of using that leg as a pogo stick at that point. So they're starting to use it, and the leg's a little bit swollen, kind of red, has some of the surgical scrub on it, which is yellow. And so it kind of just looks like a pathetic shaved chicken leg. But the biggest thing is keeping them from really jumping up on furniture, running, twisting, and those sudden bursts of someone's at the door, I see a squirrel in the backyard, the other dog is running around, I'm not, that kind of thing. So you really want to keep those twists and explosive types of behavior limited, because once you get through the first 10 days, then they're kind of out of that sedate period. They're back to their normal personality.
They stop respecting the injury, so to speak.
Correct. Yeah. And they're starting to use it, but they're still a little bit toe touching and cautious about it. But you're not out of the woods until really, 8 weeks post surgery. So after the 10 days, you get to the 4-week mark, which is then a window of time where you want them on a short leash or in their place in the house or a laundry room, and you just kind of want them to, again, not have those bursts of energy and the twists and the runs. And then at 4 weeks, we have our dogs come back in for a checkup. We take an x-ray of the knee and make sure everything's healing well. Some vets don't do the 4 week. We do. Some surgeons only do the 8 week. So then at 4 weeks, then we slowly start to increase activity again and do some leash walks, and we start to get them back moving a little bit. Kind of have a whole plan. Most surgeons have like a kind of a plan that you follow once the 4 weeks is done. Then once you get to 8 weeks, you're pretty much in the clear then to start getting back to normal activity. And then between 8 and 12 weeks at that point, which is 2 to 3 months, that your goal is to get them back to using it, getting their muscle mass back, the hair's growing back, and they're back to normal.
Nice.
So the confinement and the sedative thing, man, there's so many variables in that. What's your house like? Do you have stairs? How many other dogs do you have? Do you have kids? Does the dog do well with sedatives? Sometimes we send them all these sedatives and they don't even touch the dog. Other times we do it, the dog lays there and he pees himself and he's out of it. Like it's definitely lots of follow-up within the first 10 days.
I was going to ask and clarify some things on the sedatives. Is like, what are the typical questions we should be asking our vet to make sure that we are doing our due diligence and checking off, like, if our dog's going to have a negative reaction to it. And typically, I'm sure this is very dependent on the dog as well as the type of cocktail, but do we see some like negative impacts on that, like constipation, maybe incontinence, like to the point to where it would be a concern to the owner? Like you said, it's supposed to make our lives easier. So is there something that if we notice this and it's actually making our lives harder, then maybe we go more of the confinement route more than the sedation route?
Yeah, no, it's a good question. So constipation is not an issue anymore because we've got away from a lot of those narcotics. So we use a lot of different drugs like gabapentin for pain, an anti-inflammatory, trazodone for calming, sleeping. Sometimes I'll throw in a little acepromazine, which is more of a tranquilizer. But the biggest thing that you'll notice is if you overdo it or if it's too much, they'll like I said, they'll kind of pee in their bed or poop while they're sleeping, or they're just not getting up to drink water, or they're not eating very much. That's too much. You need to back off. And then obviously if you're, as far as true medical issues, stuff that's affecting the kidneys, the heart, all that, that's going to be probably more internal and blood testing, all that kind of stuff. But most of the stuff we see is they're just drunk and it's too much. So
right.
Yep.
Is there a typical guidance on, like you said, the 10 days? Do we not want to go over that? Like, is there a time period that, like, if we've had our dog sedated for too long, I'm kind of anti-medication unless it's absolutely necessary,
Yeah.
And myself as well as the dog. So, I don't want to, I don't want a dog strung out on sedatives that all of a sudden, they're fiending after 20 days, right?
Yeah. No, so a lot of times after 10 days, it just doesn't feel right to anybody.
Right.
Just because, and usually everyone kind of, and usually people seem like they stop around 5 or 7 anyway. But also too, after the 10 day, the dogs actually start to seem like they get used to it and it's not really affecting it anymore.
Yeah.
And so, but by then everybody's kind of almost forgotten about the intensity of the post-op care at that point, because usually the dogs are doing so well.
Yeah.
So, and if you do it right, especially with like that local nerve block I was telling you about, if your surgeon does do that, the first 2 or 3 days are awesome just because they're not feeling that pain there. And if it worked well, so then as dogs, they're not feeling pain. So that means they're not scared and painful. With us, we necessarily wouldn't be scared, but we would be painful.
Right.
We understand what's going on, but sometimes they'll shut down because they're scared and painful. So if you do that, numb the knee correctly, the next 2 or 3 days after surgery are going to be the recovery is outstanding.
Yeah.
We've been doing it now for 2 or 3 years. And so I saw what it was like before and now that we have it, and it's a huge difference.
So anything general guidance or tips or advice you give people going home? We talked about, slippery floors, putting rugs and stability. You don't want the dogs, kind of potentially losing traction. Anything outside of that you would advise people to wear? Like, if we do need confinement, okay, we need to whether we're going to bed, we're going to work. You mentioned the laundry room, you mentioned the bathroom. Obviously, traction is a big piece in that. But is there anything else? Nothing's really coming to mind on my end. But is there something else that like people bring up as questions or common concerns?
Yeah, one of them is so especially getting the runners and making tile floor or slippery floors just all carpet for a month. Another one too, believe it or not, especially if your dogs are inside, and is put a sign up for out in front of your doorbell that says text us rather than ring the doorbell.
Yeah.
Just like new parents always do that just because the baby's sleeping. And so let UPS, Amazon, or people coming over, don't ring that doorbell, text us. And then if you have other dogs that are going to be an issue, pay the money to get them boarded or send them to a friend's house for 10 days while you take care of one dog only for that time period so that dog's not trying to keep up with them. Baby gates are good. And then really just prior to the surgery, really going through your house and making sure that there's not areas where they can get injured, or if you have lots of stairs. I mean, I have people where if they have too many stairs, they'll put a mattress downstairs next to their little confinement area and be with them and like different things. I like all that just because those 10 days will go by very fast if you do all that. But
Yeah.
And then obviously whatever issues you might have on your property or in the backyard with squirrels or different, rabbits that your dog wants to chase, then you want to limit all that.
Yeah. As far as other things that we can be doing to help the healing process, I think Cliff's vet advised him to ice it if the dog would allow. His dog wouldn't allow it, and so he went. His vet didn't recommend this, but he did some research. He found some anecdotal luck and benefits from PEMF. I think it's like pulse electric something frequency. What are some options that we could be doing? Is there like a topical treatment you guys give us, massage? Like, is there stuff that we're doing on a day-to-day basis to help the healing process along?
Yeah. So the pulse therapy is basically kind of what we would do also as like rehab afterwards, which is just like pulse therapy that we would get that's on the knee. And then you have your laser therapy. So these are just different waves of energy that help with decreasing inflammation and promoting healing agents. And so pulse therapy, laser, and then a lot of places that are doing the physical therapy now, you have the water, the water treadmills, the pools. Obviously you have to wait till the knees past the suture, which is usually going to be 2 weeks on. Most these places will do physical therapy starting at 4 weeks. But the laser and the pulse therapy you can do right away. There's nothing wrong with that. Definitely anti-inflammatories. We send home with a good topical antibiotic or topical kind of doggy Neosporin that they put on the sutures. Huge icing fan, but the dog has to let you do it. And that's another component of if the dog's knee was numbed up and they're on the right sedatives, they will let you ice it. And if that's the case, you're going to see quicker improvement. I think ice is awesome. And so that's where if your dog won't let you, then they don't want that to be touched. But if it's numb and they're kind of sedated properly, then you get ice it all you want and it's going to be good for them. And so basically the pulse therapy, laser, massage and physical therapy, again, they don't really like to do that until kind of 4 weeks. Some start at 2 weeks. And when you go to these physical therapy places, they have different little ramps and kind of agility, movement type things that they do. But that's all good just because you don't want to be too careful, too cautious, too conservative, because then the knee's going to kind of get stoved up and you're going to get all the muscles are going to atrophy. And then you're going to be dealing with just a really weak knee. And then you're going to be, you're too good. You're too good of an owner, and now you're going to have some issues. Yeah. So, and then that puts a lot of stress on the other knee, which is probably going to go as well, just genetically speaking.
Yeah. Anything else worth mentioning that maybe you've heard to where people just swear by, off the wall alternative options? I don't know, freaking acupuncture, burning sage, essential oils, anything like that you think that might help, that at least won't hurt anything.
I mean, I've seen acupuncture do some amazing things. I've also seen it not work. I'm all for that. And then also when you talk about burning sage and some of that, I mean, you get into essentially, to me, what that does is more of calming, decreasing stress. And if you can decrease stress, calm the dog, your cortisol's low, which is the catabolic steroid. If that's low, you will heal quicker. And so, voodoo aside, with all that kind of stuff, if you are able to decrease stress and anxiety and pain in your dog, and they're comfortable, happy eating, they're with you, they're at their home, their cortisol will be less, they will heal better.
Nice. Yeah, so play that soft music in the background and everything. Yeah.
Yeah, whatever they
That
want.
it's not
So
going to hurt, right?
do some duck calling with them, whatever makes them happy.
That might rev up some dogs unnecessarily.
Yeah.
All right, so as we're kind of nearing the end of this hypothetical journey, you talked about this is something that Cliff made a note of in his experience. His personal story was the vets that he was dealing with. Obviously, they were great. They gave him some great advisement. He spoke very highly of his vets, but part of him thought that maybe the vets didn't really recognize the level of physicality that we do on a day-to-day basis with our dogs. And so when they advised him to, I think they told him at 16 weeks that, not to go home and throw a frisbee, but that he could go back to normal everyday activities. And to him and myself, it's like that's kind of contradictory in our world. Throwing a frisbee really isn't that taxing, especially at 16 weeks, whereas you just said around 8 to 12
Yeah.
weeks we're getting back into the normal swing of things, and you have that perspective. You understand what we require and ask of our dogs, and so you say we're good to resume normal activities around 8 to 12 weeks. Walk me through that, because some people might hear that and they're like, all right, we're out of confinement. We're good to go. All right, let's go on a 10-mile hunt in Montana, right? Like, so,
Yeah.
how when you say normal activity, let's add some context to that.
Yeah. So again, the 8 week x-rays, you have to make sure that they're pretty much healed at that point. Once you get the green light on that, then it's going to be okay. The bone's healed. Now I got to get all the ligaments and tendons and muscles and everything back in action, which that is going to be the slow, you're going to be doing, say you do some leash walks for 25 minutes and then you bump it up to 30 minutes the next week. And then you get into where, it's a brisk walk. And then again, it's, it kind of goes into no different than if you didn't do anything with your dog all summer and then you're going to go out September 1st and just release the hound. And that's kind of the same thing at that point, where the surgery for the most part has healed. Now we need to get everything else back in check, which even includes the heart, the lungs, their stamina, their feet. Can't forget the feet. And
Yeah.
so the 16-week thing, that might be something newer. Like I said, our vet we use, he's just turned 60. He's done 9,000 of these, and that's just the protocol we use, and it's very successful and it's worked. And I saw my uncle's dog go through it, and by the time that dog was at 12 weeks, everybody forgot about the surgery. So if someone's saying 16 week, that might be that university they came from. That might have been their mentorship. That might be what they want, what they see. That also might be them just being very, very, very cautious and just what they recommend. And they might disagree with what I'm saying. From what I've seen, you can say, yeah. So basically, you just need to get everything else back in place, which is the muscle mass, the stamina, and movement again, because they've been pretty caged up for 2 months.
Yeah.
So that's the goal, and that to me takes another, between 8 and 12 week. That's a good time frame right there where you're really starting to go out and you'll know. When I tell clients that if they overdo it, they'll let you know, and they're going to be sore. But also I have them do every other day, so they have a day of rest, which you usually don't do with regular dogs or aren't injured. And so I do the every other day, and they slowly increase. And it's good to go.
And that's a good point on the outliers, the fringe stuff to where we're not only focusing on the knee, but you're focusing on the feet is a huge thing. If they have 2 months off, their feet are no longer conditioned. Maybe it's worth even doing something like a conditioner, like Tough Foot or something, while you got the time off. But then also they're going to be sore everywhere else. It's kind of like us. If we take, a long stretch away from the gym or something going back in, it's not even so
Yep.
much the muscles we work that get sore,
Cramps.
fatigued. It's like we get cramps, the stabilizers that you use very often. That's what people feel in the soreness more so than even the muscles that they work if they go throw an iron around and they haven't touched it in 5-6 months. So that's a
Yep.
good consideration. I want to, what is your experience? How often are you seeing both failures in this procedure, but then also I want to get into the odds or likelihood of the second knee going out? And do you offer, when you're advising people, if you're doing the side-by-side x-ray, and you're noticing that that second knee is slowly deteriorating, whether it's from the genetic component, which is obviously the same genetics, or overcompensation for the other leg? Talk to me about the pros and cons of doing both knees at the same time.
Yeah, so I've only done that once, and it was with a different surgeon that we used to work with a couple different ones. He was okay doing it. Everything went fine, except it was a lot of work on the owner. It just never felt right. Was it more cost effective? It was because it was all one anesthesia. Was it a lot on the dog and the owner? Yeah. Have I done it since? No. And so some places will. If you're up for it and you have a surgeon that is okay with it, just prepare yourself that it's going to be just you're going to be carrying the dog because they don't have a good leg to stand on, literally. And so yeah, I just recommend doing separate ones. And as far as the failure rate, like I said, in 11 years of being a vet and 9 years of working with doing TPLOs at our facility, I've seen two, one with the other surgeon, one with the one that we use. Both were just simple infections, and this was prior to the newer plate. Um, and we removed the plate 6 to 9 months later, and everything was fine. Once you get the plate out and the infection's cleared up, the bone's healed, the goal's accomplished. It just sucks because you didn't have the best outcome. But
Mm-hmm.
again, we have less than 1% infection rate, failure rate. Other places, and again, I'm not trying to knock them or anything like that, but the average of what you read is 10 to 15%. So again, finding facilities and places that you trust for good outcomes and producing good results is important. And then as far as the other knee going, that's why whenever a dog comes in limping on the right leg, we take x-rays of the right leg, the left leg, and the hips, because we want to make sure that we're not missing anything. And then a lot of times you can see at that point the left one is starting to go, or they're both need to go, and that's when you can stage it. We stage it. We do one now, we do the other one 6 months later. That kind of thing works great. They say that 80% of the time that the other knee is going to go if it's a huge genetic component. Um, to me, and a lot of vets believe in that 80%. I don't know if it's changed. I don't know if anything. I don't think it's that high. I haven't seen it that high. We've had plenty of dogs that needed both knees done within a certain time period, but to 80% is high on my side. And again, but I haven't been keeping track of that and really the numbers. But the possibility of the other knee going, if there's a strong genetic component, just prepare yourself.
It's going to happen.
Yeah.
Yeah. Is there any chance, and this might be a dumb question, but is there any chance that it kind of heals or gets better over time if it's not a genetic component? Let's say it's overexertion or overcompensation. By
Yeah.
fixing the one leg, does the other one kind of balance back out and regenerate almost? Kind of the inflammation go down over time?
I think so. And it's another thing too is that, well, like Terry Ann with the Bird Dog Society, her dogs are having hip flexor problems, which can sometimes present like knees. And so we think it's knee and it's actually the hip flexor. If your dog's overweight, you're not doing the proper exercise, you're not doing any supplements, you don't have them on any anti-inflammatories, all those things, then that right there can fix the other knee that maybe has the potential. And so you do want to do all that. And most people, once they go through one surgery, they get pretty aggressive at doing that because they don't want to do it again. When I was at Colorado State in vet school, there was actually an orthopedic surgeon there named Dr. Goh. She was doing study and research that when they would fix one knee and the other knee was okay, they would scope the good knee and inject PRP, which was like platelet-rich plasma, or like the stem cell, trying to see if it would prevent the other knee from tearing. From what I remember, they found that there was maybe minimal help with that. Don't quote me on that, but it wasn't just like a aha, because otherwise we would be doing that.
Yeah.
But it was kind of a bummer because we were looking at saying, well, we know this knee's going. How do we find a way, and let's do some an actual, peer-reviewed study to try to prevent the other knee from going. And I thought it was great because, she would fix the knee and then go over and do stem cells and scope the other knee and say, all right, let's keep track of this dog for the next 2 years. And unfortunately, it seemed like didn't matter.
That's unfortunate.
Yeah.
You talk about underlying issues, and this is something, circling all the way back to the start of this, very often you can kind of see through the conformation, the gait, you can kind of see it, or maybe other litter mates or other litters from the same parents. Like you can start noticing certain things. And when I was talking to Cliff, he admitted that he had noticed some lameness issues prior to the knee going out. He had noticed that, after hunting, the dog would be really sore the next day. And at the time, he kind of just chalked it up to fatigue, right? We hunt our dogs hard. It's okay. They're going to be a little sore. But then the lameness still pertained after the procedures, because he ended up getting both knees done, and even after that there was still some lameness. And it sounded like I think he said it had to do more with the hips overall. I can't remember, but he talked about doing some research, and he didn't have a vet recommend this, but he went out, did some research, and found an option with like Librela injection treatment plan. So what is Librela? Is that something that can help in dogs that maybe have some arthritis issues, hip issues, or even potentially these ACL issues?
Yeah, so Librela is a brand new injection that just came out last year that is for arthritis. It falls in the category of what we call monoclonal antibody, which is basically, if you think of if you fell and you hit your knee and it's red and swollen and inflamed, you're going to have a lot of things that are released that we call inflammatory components or markers. One of them is going to be, believe it or not, histamines. So we think of histamines like, insect bites and everything. The other one's going to be prostaglandins. Prostaglandins are what causes the heat, inflammation. That's what, like, your Rimadyl is going to stop. In us, ibuprofen, Tylenol, that handles the prostaglandin. That's part of the inflammatory process of trauma. Those are catabolic chemicals that tear down the knee, create arthritis, and that's just the process of life. Well, there's another one that's called NGF, or nerve growth factor. The Librela stops that one. So it stops the whole cascade of arthritis to begin, the pain that's associated with that nerve growth and the heat and everything that's associated with that. And so they found that if you can block that, with this Librela injection, or at least kind of calm it down, that you see a much more drastic response to anti-inflammatory treatment in arthritis. The reason why it's controversial right now is you can't use it in puppies because they're full of this nerve growth factor, and you can really screw things up, or pregnant dogs. The issue right now is that they've seen some issues with some neurologic stuff with it. And then also the biggest report is some urinary incontinence with if it's an older female or just female in general. The problem right now is that it's just a heated debate in the vet world. Like one of my doctors, that works for us, she's on some Facebook group that's like anti-Librela. It's like literally anti-Librela Facebook group. And so she sees all the negative stories. And then we have clients that come in that have been getting it, and they're in tears showing me videos of their phone of the dogs running and chasing the ball. And so you see both sides of it. And it just hasn't had enough time to really mature in society. But Dr. Joseph Spoo, the gun dog doc, he did a podcast a couple weeks ago with I think Scott Linden, and talked about it a little bit. Now he's a rehab specialist, and so he's has other alternative ways of really treating that. He's very cautious of it as well, just because of what's report. I'm actually not, and the reason I'm not, and I'm willing to do it, is because I find that these dogs are in such bad shape, or the arthritis is so bad that, and having a bad knee and shoulder myself, that sometimes other alternatives are at least worth the shot. I haven't seen true negative effects yet. Once I do, ask me a question again. But right now, I find it to work well, as long as, again, there's not neurologic stuff going on, and the owners also understand. I have this conversation with them, so they're not mad at the situation. But in the vet world, if you have a dog that has allergies, the sister product within the same kind of science is called Cytopoint, which people get Cytopoint injections for the dog with allergies. It used to be Apoquil, or you'd use Benadryl, all that stuff. But then Cytopoint was the one that we give as a shot to stop allergies. Well, it's the same type of situation, what you can stop. And Cytopoint has its own issues with possibly causing issues with your dog's platelets, etc. But I give one of my short hair Cytopoint all the time because it helps tremendously with your allergies. And it's nice. I don't have to give pills, and I haven't seen any side effects. And so, because that one's been on the market now for over 10 years and I've seen good success, and I know it's along that same kind of classification of science, that's why I'm a little bit more comfortable and aggressive at using and experimenting with Librela. Yeah. I also trust the company. I also trust the research they've done. I've met with their orthopedic surgeons. I've had lunch. I've seen the studies. I have seen all of it, to where I feel that right now I'm comfortable with it, but not all vets are.
Yeah. And that's a fair and honest assessment. And I mean, you can't really ask for any more than that, to where it's a new medicine or a new treatment plan, not even medicine. And so obviously with that, like, there's going to be guinea pigs, right? Like in all of this stuff. So it's really kind of your prerogative. It's up to you to make the decision and decide whether it's good for you or your dog. I don't know what neurological side effects you might be referring to, but I'm curious, like with the urinary incontinence, I mean, heck, Rachel is incontinent from her spay surgery years ago, and I treat that with Proin, whatever. I just call it Proin. I can't pronounce the whole thing. Would the side effect from Librela, if you do have the urinary incontinence, could that be controlled through the same, Proin approach?
They say it can, yeah. But like, if you went in your vet and said, "Hey, I want Rachel to have it," and they said, "Well, she's on Proin for urinary incontinence," this is it. We don't know what will happen. They say not to use it, but you still could.
Yeah.
So, because there's sometimes where, I mean, if you see some of these before and after videos, it's insane. I mean, it's an aha moment. It's very different than if, the times you take glucosamine and you're going, I think it's working, or it's these mild changes, or if you take probiotics every day and vitamin C and you're not getting sick and you're healthy and you just kind of know that it's good for you, but you're not quite sure. This is something where it's an aha, wow, that did it. So.
Well, I mean, quality of life goes a long way. I mean, the side effects, I mean, heck, if it takes, a year or two off, but the dog gets to spend 5 more years in comfort doing what it loves to do and why it's here on this planet, obviously there's no way to really gauge the trade-off there, but that's why you just kind of have to make the best informed decision, to where, like, hey, if your dog can't really live day to day, it can't run, it can't enjoy life, I would argue that the quality of life for just a few years that affords them would be better, even if it does take something off the back end.
So. Yeah, no, I agree. So,
well, man, I'm kind of tapped out on this subject as far as questions on my end, so I'll just kind of throw it your way. Is there something that comes to mind that I should have asked you about this whole ordeal that I didn't?
No, I think just making sure, this is a big deal. This is a big procedure, especially with hunting dogs that we're asking a lot from them. It's not your backyard dog that's going to get the knee surgery. They're going to do fine. They're going to have just a pretty average life. We're our athletes. I mean, this is, if you have a dog that do what you and I do, that has this happened, it's a huge bummer, because I've had shoulder surgery and it's still never 100%. Same thing with these. You're going to be significantly better and you're going to do whatever you need to do and everything's going to be good. But every once in a while, you're going to still see your dog limp and still see some things. But for the most part, that's just arthritis and part of the process. Could have happened prior to surgery. And, surgery just postponed it. And so really knowing that this is a bigger deal, and I'm not trying to, downplay the house dog, but I think it's important that you find an orthopedic surgeon and a vet that literally explain and hold your hand for the first 4 weeks, especially 8 weeks during this whole process. And I think that's why Cliff kind of wrote what he did. And I'm glad he did, because I'm going to share that with people, because that we as vets sometimes forget, what are you going through at home? Because this is routine for us. From 7 o'clock to 5 o'clock, I go home, and then you're sitting there, the dog's whining, he's not sure what to do, you have medication questions, and like we have, a text helpline, and we check in the next day after that, the 10 day, like you need that so that you have a successful outcome. And when with sporting dogs, I don't usually always recommend this with the backyard dog, but with all my sporting and hunting dogs, we work with a physical therapist that's in town that does acupuncture, laser, shockwave, all that stuff. I tell them, you're doing your animal a disfavor if you do not schedule with her after the surgery, because that is how you're going to get them back into the field quicker after the surgery. Other dogs are your backyard dog. They don't seem like they need that, but I do believe that what we challenge our dogs with, that they need the acupuncture, the laser, the shockwave. They need not only their knee work done, but the other knee. How are their hips getting their back into, like they need the whole project to work so that you can then be successful in the fall.
Love it. All great advice. I appreciate your time as always, coming on, sharing your wealth of knowledge with us lowly gun dog hunters and upland hunters in general. Until next time, man, I know we're going to come out with something here in another couple months that you and I are going to figure out, what to dig in deep on.
Yep. No, that sounds good. And yeah, if anybody has any questions, just reach out to you and you get a hold of me. I'm happy to help. And
perfect. Awesome.
Appreciate it.
Well, good luck in the turkey woods next week, man.
All right. Thanks, Nick.